Welcome back. So, I finally got some answers on our quest for the beginnings of understanding some of the aesthetic nature and dermatological effects of Ehlers Danlos. So, I did a video before just going over the general dermatological effects of Ehlers Danlos, but this one is going to be a little bit more focused on the beginnings of understanding what aesthetic procedures that we can possibly look into to preserve our collagen and just live like everybody else and get lasers done and that kind of thing. So I did get some answers. I've got all my notes here, as you love the notes that I always have. They're everywhere. But I watched two webinars this weekend, and they were from a dermatologist finally that focuses a little bit more on EDS in his practice. So I'll link those down below. So let's get started. So the main thing, and I think everyone kind of like on this channel kind of knows already, that with Ehlers Danlos, it's an abnormal collagen. So collagen is usually very like straight if you look at it under an electron microscope, which is just a magnified microscope. If you're looking at the skin, the fibers, the collagen fibers are very straight and uniform. And with Ehlers Danlos, they're all frayed and abnormal. So that's one thing. And that's why like a lot of people have different kind of scarring called atrophic scarring. And I also found that it was interesting that up to 50% of people with Ehlers Danlos don't have a family history of it. So I think in the past, we always learned that Ehlers Danlos was autosomal dominant, meaning that one of your parents has to have it. But now we're finding so many different subtypes. So I think that that's why there's more awareness of it, because people are realizing that I think I do have Ehlers Danlos, some form of it, maybe not, a very severe form where I have extremely stretchy skin, or I had a family member with it. So that's important. So in normal collagen is made up of 80% type 1 collagen and 20% type 3 collagen. So abnormal, and that's in just a normal person. And then abnormal collagen is type 5. And so it's up to 90% of patients with EDS have abnormal collagen, so type 5. And that's the frayed collagen where the skin can't heal, it can't hold on to scars. And I just learned a lot about healing in this video that I'm going to share. But just to understand that we have so much more abnormal collagen than normal. So that's really interesting. Sorry, I keep touching my face. I feel like I have like a piece of hair on my face, driving me nuts. And then let's see. Another thing that was interesting is that I know, and I think I've showed this in videos about the translucent skin. I definitely have translucent skin. Like you can see, even though I put bronzer on, that looks really horrible, but usually you can see all my veins. And so the reason why that is because in a patient with EDS, 1/3 of the dermis, the dermis is usually the thickest part, or actually the epidermis is the outer part of the skin. The dermis is it's the deeper layer of the skin. And that is also what's most affected by EDS. And in patients with EDS, their dermis is like 1/3 as thick as normal. So that's why we have that translucent skin. And then keep in mind that the dermis is what's most affected in EDS. And that's why when we're looking at procedures, and this was probably like my take home thing, is when we're looking at procedures, things that affect the dermis, we really have to be careful about. So we want things that affect the dermis because that's where collagen is made. And that's like the building block, the supportive part of the skin. But that's what's also most affected. So that's why the dermis, which is the structural part of the skin, is lax, leading to that skin laxity and the abnormal healing in patients with EDS. So, and that's why you get that like skin, translucency. So the main thing that I learned, and that's probably the majority of the rest of this video, is that he came up with like the 7 S's, which is the skin management in EDS. And the first one is skin protection. So, when I hear the word skin protection, I think, oh, we're talking about like UV protection. But when he went over it, it's more like, protection against, especially in kids, protection against just injury, because kids like, just have a little more prone to injuries and that kind of thing, even though I personally, as an adult, I think I'm prone to injuries as well. But just protecting, like not recommending contact sports and that kind of thing, but also just protecting your skin. So, even just having like what I have on now, like it's not for protection, but it's for this video, but like thicker fabrics are just more protective so that you're not, when you bump into things, you don't get bruised. So skin protection, that was like the first one. Bandages, braces, whatever you need to protect not only the joints, but, and about that with EDS, like you're trying to protect the joints, but then you're also trying to just protect the thin, fragile skin, because even a small injury can turn into something more when you have EDS. And another thing, and I'm still going to, do a video on the skin biopsy that I had, and I have a dermatologist that really knows a lot about EDS, but they put a really strong adhesive on the skin when I had the biopsy, and it actually like ripped and irritated part of my skin. So avoiding strong adhesives is another thing in the management of EDS. And we'll talk a little bit about that in a second. And then the second S is going to be sun exposure. So, there's UVA, and I talk about this on my channel too, UVA and UVB. So UVB is like the burning rays, and UVA are the aging rays. I think of A, aging, B, burning. And not only is UVA aging, but it's also the rays that penetrate into the dermis and destroy collagen. So whatever you're looking for a sunscreen, you always want to look for something that's broad spectrum, containing both UVA and UVB. In the United States, we mainly have like a sun protection factor, the SPF. You're always going to look for something that's broad spectrum and SPF 50 or greater. But then another thing that they have in a lot of other countries is the UVA spectrum, and that's from 1 to 5. They get a UVA rating on their sunscreen. So a lot of like Asian sunscreens will have their UVA rating. So you want to look for the highest UVA rating, preferably 5, because then that will protect the skin against the UVA rays. And UVA rays are also the ones that come through, like, I mean, right now the windows are I have shades, but the UVA rays are also the ones that come through like your car, they come through the windows. So you always have to be careful if you're someone with EDS, or really any patient, or any person. I always call them patients because I'm a physician, but any person really needs to protect their skin against UVA rays. So if you're inside and if you're by a window, you want to make sure that you're using some kind of UVA protection. So, and then now I also did a video on this, on UPF hats and UPF clothing. So UPF is basically sun protection factor in clothing, and a lot of them have UPF 50 and above. And we've come a long way in terms of things that are much more fashionable for UPF clothing. So those are things you want to look for. And, I had a question a few videos ago: are people with EDS more prone to wrinkles? And they're not necessarily more prone to wrinkles more than anyone else, but you really want to avoid those wrinkles in the first place, because wrinkles are a sign of UVA damage and damage to the dermis. So that's kind of like the telltale factor of, if you've had UVA damage to the dermis. Okay, and then the other one are supplements. So supplements, vitamin C in usually 1 to 4 grams per day, ascorbic acid. There's really no studies that show that ascorbic acid is helpful with EDS, but it has been shown just in general, vitamin C, ascorbic acid has been shown to help with wound healing and decrease bleeding. So personally, I use vitamin C. I just take 1 gram a day. Any more than that, you just have to worry about kidney stones, but I do take 1 gram a day. And I can't say that it's necessarily made a difference, but I do notice if I don't take it. So vitamin C is definitely something that is not toxic. Just make sure you don't, you stay hydrated and you don't have a history of kidney stones, and you can definitely take 1 gram a day of vitamin C. And then estrogen replacement. So estrogen replacement in just a non-EDS patient has been shown to increase collagen. There are no studies in EDS patients, but that's also something to discuss with your physician as you become, if you're, a female, as you become postmenopausal, discussing estrogen replacement therapy. And then the other S, I don't even know what number we're on right now. We're on number 4. And then also vitamin C, and I think I've talked about this also, as just a cofactor in producing collagen. So number 4 is to stop smoking. Smoking damages collagen and also increases wrinkles. And the next one would be steroids. So always caution with topical steroids. So a lot of patients that have EDS also have like eczema, psoriasis, rosacea. You always need, and lots of skin issues. Just beware, and definitely if you're going to be on a topical steroid, make sure that it is managed by a dermatologist. Most dermatologists know how to manage topical steroids safely. It doesn't necessarily have to be someone that is specialized in EDS, but you do want to just kind of make sure that topical steroids, that you don't self-prescribe them, because they can thin the skin, and the last thing that we want in someone with EDS is to have thinner skin. It can cause thinner skin, skin damage, more prominent vessels, and thinning and breakdown of the skin. So you definitely want to avoid those. And then the next S, the number 6, is surgery. So I thought this was really interesting. I have a few videos on, I had blepharoplasty, which, knock on wood, it went well. Other than that, I've had like a few minor surgeries, but that was like my main skin surgery, and it did go well. My physician, my surgeon, knew about EDS. So I think that's the first thing. If you're ever going to have any kind of skin surgery, which most surgery does affect the skin in general, if you have an incision, but if you're actually going to have something done, especially as we look into more aesthetic procedures, make sure that your surgeon, plastic surgeon, understands EDS. So the thing that was interesting in terms of what I saw with this webinar is bruising is more prominent. I actually didn't find that the bruising was more prominent when I had surgery, but the treatment for that is just, elevation and ice. So those are just the basics that you would do. And it was interesting because cuts, they recommended that if you get a cut and it's a clean cut, less than 1 centimeter, it's pretty regular. What you want to do is you want to treat cuts more aggressively and actually use steri-strips. So steri-strips are these little dressings, that hold a wound together, and they're not irritating to the skin. So you would use steri-strips to put that together and make sure that there's no tension on the wound, because wounds in EDS, because of that lack of normal collagen, tend to split open a little bit more easily. And so that's why you're having the steri-strips to hold them together. So you also don't want tension on it, meaning, if you move, you don't want to have tension opening up that wound again. And then if there is tension on the wound, then stitches are recommended along with steri-strips. And stitches in general, I thought this was interesting too, is that stitches are recommended to be placed and in any kind of wound in a patient with EDS for 2 times as long as normal. So if, just a regular patient has stitches in post-operatively for 7 days, they're going to recommend that they stay in for 14 days with a patient with EDS. And then for the next week, you would have the steri-strips. So most patients will, have something, they'll have the stitches, it will be a week that they're in, and then they don't have steri-strips after. But instead, you have the 2 weeks or double the time, and then you also have the steri-strips for an additional week in order to have healing. And I've never, when I had skin biopsies and that kind of thing, I've never had this done. So that will be interesting if I ever do have a skin surgery again to know that. And one thing I do know, when I did have a skin biopsy, I had one done here. I had to have Mohs surgery. My doctor, again, knows a lot about EDS. And so I didn't even realize, he told me that he was putting in double sutures. So an epidermal and a dermal layer of sutures. So 2 layers of sutures. So again, most patients would just have 1 layer of sutures, but he placed 2 layers of sutures, one in the dermis and one in the epidermis, because that's what we need when we have EDS. So, and that's what's recommended with EDS patients whenever you're having sutures. So these were very interesting. And then let's see. And then he did say, he touched on in this video, of course, we all wanted to hear more about procedures, but he did touch on 2 procedures that are not recommended with EDS, and that's dermabrasion and fillers. And I definitely don't disagree with the dermabrasion, because dermabrasion is basically trauma to the skin. So I think when you're always thinking about a procedure, no matter what, you have to think about most people will recover from trauma to the skin normally in order to get some sort of beautification procedure. But with EDS, we don't recover normally. So avoiding things like microneedling, dermabrasion, and then fillers. I'm just thinking that possibly because personally, I think that fillers would increase the laxity of the skin because you're stretching the skin. And then when the fillers, I mean, if they ever do actually, wear down or whatever, then I would think that you would have more skin laxity. And then also just, weird allergic reactions to fillers. And then he didn't really touch much on lasers, but he did say that vascular lasers are okay. And I can definitely attest to that because I have been getting V-beam. V-beam is a vascular laser, a lot of times used for rosacea, and I love it. It does cause bruising, but it's not doing anything to the dermis. So again, I think the main thing that you want to focus on with lasers is something like BBL or IPL. Those aren't really lasers, those are light. And then any kind of, if you're looking for a more aggressive laser, something like not Thermage. What am I thinking of? I don't know. I was just away for the last week. I can't believe I can't think about Fraxel. If you're thinking about something like Fraxel, you want to make sure that it's more of the non-ablative Fraxel. And again, just having someone that understands EDS. So basically trying to do any kind of skin rejuvenation in a non-ablative type way should be safe in patients. And that's, again, what I hope that we learn about more with my channel. And let's see. And then along with the supplements, he did talk about collagen, like taking in collagen supplements. And, I still think that there's a lot going on with collagen supplements now. I have to sneeze. Okay, that just went away. Collagen supplements now, are they too big to get into the skin and that kind of thing? And nothing, again, I think we'll have a lot more of this in EDS, but it is finding that possibly they can be helpful for the skin. So if a collagen supplement makes you feel better, it's likely not going to be harmful. And then the final S is skincare. So I'm glad that he touched on this. I watched 2 of his webinars, and the first one was like 5 years ago. And then the most recent one was from like a year ago. Actually it wasn't a year ago. I don't know, but it was more recent. And he added on this last one. And he said basically that for skincare, vitamin A, vitamin C, and vitamin B are all helpful in Ehlers Danlos. And so I've gone over this in videos. I have a previous video talking about this, how I know that I'm always just going to continue things that work for other people, such as vitamin A, which is, your tretinoin, your retinoids, your retinols, retinaldehydes. Vitamin C, particularly the ascorbic acid type, which is in, I did a whole video on vitamin C, ascorbic acid. And then vitamin B, I didn't even know of. So something like niacinamide. I mean, I use a lot of that most people just have that in their skincare in general. And that's in a lot of the vitamin C's that I reviewed. So a lot of the vitamin C serums have vitamin B in them. So I thought that was interesting that he actually added that in about the A, the B, and the C. And that was basically all that I learned. And hopefully we'll learn more, but I think it was just helpful to all the things that I've speculated with my skin have kind of been validated by this video. So again, share this. Right now, again, my videos are not, I don't really post them all like in sequence, but right now I'm at 122 subscribers. So I'm very excited about that. I'm trying to just, spread the word to people with EDS, people that have family members with it. And again, I hope you enjoy watching my videos no matter what, because, we do talk about other things, but that's kind of my main focus of the channel. So thank you so much for watching. Please let me know any questions below. I love to see an extra subscriber, and I love to see comments because that really means that we're all kind of thinking and sharing. So thanks so much, and see you next week in my next video.